Hi guys, a very warm welcome to our new podcast. We have with us Martin. We met at a event at RWTH and then we had a talk about our college life, about our personal life, about our hobbies, and I found that Martin here has very interesting hobbies, something very unusual and very intriguing uh, in all senses, and I think he has dived into various topics and themes from different subjects, which seem very intriguing to me. I had even talked about him and mentioned to him as like, you are the Sheldon from the Big Bang Theory show. That's how many projects he does in a month or so. And so let's have a discussion about his different projects and some of the topics which interest him. So let's begin. So, Martin, which is the first project or project you would like to talk about?
First, thanks for that very generous introduction. I think we got talking first at the event about my COVID vaccine candidate, which I did in, don't let me lie, I think 21, late 2020, which at the time, this was just when the official vaccines came out, and I was fairly uncertain if Germany would get them in time, so I just thought it would be fun to make my own.
And how did you come up with the confidence that you could like prepare a vaccine? Actually, like it's like too much of a feat to.
The funny thing is, there was one German doctor who was a bit of, we would call it a Schwurbler, kind of a conspiracy theorist. He's very competent when it comes to biotechnology. Actually founded his own biotech company. Just has very strange political beliefs. And I was reading his blog at the time, and it's half like how to do actual vaccine work and half how Merkel is turning Germany into a fascism. Complete nonsense, obviously, but the proposal that he came up with in the end was fairly similar to my own. And I had the idea before. I was kind of dabbling in biohacking, just like molecular and genetic engineering. I find the idea very intriguing, like that we can actually change or make substances on the molecular level. Like we're talking about orders of scale so small that it feels almost impossible that you could even do something as precise, like working at nanoscale precision. But obviously chemistry makes that possible. Like we do chemical reactions all the time, and bioengineering is basically just the same, but you're working with proteins rather than chemicals. And the idea behind vaccines is actually fairly simple. Just giving your body something that it can recognize and defend against. And I thought, what's the simplest thing that could be done? In business, there's sometimes the idea of like the simplest possible product that you can make. I forgot the fancy word, but there is a fancy word for that. And that was basically the idea. What's the simplest vaccine candidate that I could make at home? Or at a lab, basically, but at a budget that I can afford and with my tech level.
Okay, so you had said to me before that you have interest in biotechnology and even biohacking. So did you like start from scratch about the vaccine, and like what were your, maybe you can tell us 5 steps in which you did the vaccine, and even maybe the equipment, or how did you get access to that?
Yeah, I think the idea is essentially you need, first of all, you need a target. You need something that you actually want to make. And at that time, people in the biotech community were tweeting about the receptor binding domain of the virus, like basically the aspect of the virus that binds to your own body and that the virus uses to transfer its own information into the cell. So that was all public. And I was basically thinking, how hard would it be to turn that into an instruction, so to speak, into a command to another cell to make this protein. That's usually called a plasmid. It's often a circular string of RNA or DNA that you can inject into some kind of host. Could be yeast cell, could be bacteria, could be human cell actually. And I just started, like, basically did this as a logic puzzle. Like, can I make a plasmid for this thing? And it took me a bunch of tries, because you sometimes get, just by doing it the trivial way, you can end up with sequences that have a different meaning and context. It's a bit like poetry. Sometimes you put words together, but they just end up with a different meaning than what you intended. And there I basically got a bunch of terminator sequences, bunch of codes that mean stop making a protein here. And I had to rewrite it to get rid of those. Got that in the end, and ended up with a plasmid that encodes just the receptor binding domain of a variant of COVID. Like, this was optimized for the second variant. Then I needed to decide on a host. Just pick the most simple one I could find that is commercially available. And then luckily I had contacts with the lab. It's kind of tricky to legally make GMOs in the European Union. There's a bunch of laws about like who can make it and where you can make it. You also need a clean room. That was the fourth part. Where like first come up with the DNA that you want to make, then with the protein that you want to make, encode that into a plasmid, find a host for that, express it in the host, and finally filter out the protein you want. And then put that, like I added another chemical that enhances the immune reaction, but that's not technically necessary. You can also use it as is.
And did you like test it on like a animal or first, or like?
No, I just tested it on myself. My friends were kind of like, I would never try this. I feel like maybe I just don't respond to these like very low certainty risks. Like, I'm not afraid of bungee jumping and the like. I'm like, yeah, there's a small chance that the rope will break or something, but it's so minute, I'm not gonna care. And here was also, there's a chance that the clean room isn't perfectly clean. I did this in late spring, I think. Not actually sure, might have been summer. But it was around the time where there's still dust and pollen and the like in the air. Just like tree and plant cells. If those end up in your vaccine, you're immunizing yourself against those as well. So I could end up with allergies. And if your vaccine is very strong, this can be critical allergies. Like, you're immunizing against yourself against something, it can be an arbitrary substance. You could immunize yourself against milk protein, and then you have a milk allergy. It was the joke at the time, because we had to make this protein, and I ended up with, I think I bought 5 milligrams, could have been micrograms, I think it was milligrams, of protein. For the same money, I could have bought, I think, 1 metric ton of milk protein, because making proteins on so small scales is really expensive. But yeah, I wasn't particularly worried. I think I was still a bit nervous at the first injection and had like a friend on standby. So if I went into anaphylactic shock or something, they could have called an ambulance. But it was fine.
Okay, and so like to test the efficacy of the vaccine, you later like got in contact with a COVID virus, or?
Yeah, I actually bought a bunch of at-home tests. Like, there are these virus tests, but there are also antibody tests. It's a test for the virus, where basically it's either antivirus or antibody in the test. If they find each other, they tend to clump, and then you can find these clumps by adding another chemical, and you get these like red stripes on the test itself. The problem is I wanted antibody tests that test for the receptor binding domain, but I got antibody tests that test for the capsule of the virus itself. So it's basically like, I don't know, you make this app that is like really good at teaching you languages, and then you learn all the birds in French, and then they test you on all the mammals. And you're like, I haven't learned these, I don't know any of those words. It's kind of what happened with the tests. The tests tried to test for something I didn't immunize myself against, so they're kind of useless. I had one contact that worked at an actual lab with actual COVID viruses. The test looked promising but inconclusive. We would have had to do more testing, but at the time I also got access to the official vaccines, and my social life was kind of non-existent at the time. You might remember how hard it was to go outside. So I was just like, yeah, I'm kind of done with the project now. I want to go outside again. So I just got the official vaccine, which obviously ruined my blood, so to speak. Like, then you have 2 vaccines, you can't test which one is the one that causes the reaction anymore. So in the end, the conclusion is what most students also get on their thesis, like you have a proof of concept, but you don't actually have a strong conclusion either way. I don't know if it's useful or if it's useless. I think it probably worked, and it was just a fun project overall. And it usually makes for a good icebreaker, as we've seen here.
Yeah, totally. It is like even a crazy thing to like start developing vaccine, and I mean to like have a product which you can call like I've prepared like a vaccine, even if you don't like really get to test its efficacy or how good it is, but still it would have been fun for you. Now
Yeah. I think it also raises fun questions about the role of like research in society or in politics. Like, I'm still low-key convinced that we should have done this in Germany. Let's just like make something similar to my candidate. We could have done, like, a single lab would have been enough to supply the entirety of Germany. You can make 80 million doses, or like 80 million doses times 5, or however many you want to use, within a month or 2 in a single lab.
Okay. So would you say, because these limitations are because of the like high EU regulations, or maybe in foods and drugs industry regulations in EU are way stricter than other parts of the world? Could that be?
I think it's more that like testing is necessary. Like, these regulations exist for a reason. You can argue that these vaccines are so simple and so safe that we don't need as difficult testing. But once you allow that kind of stuff, every biotech company is going to be like, oh, our substances are so super safe, and then people start dying at some point. Regulation, like there's a saying that regulations are written in blood. You only get a regulation after something really bad happens, because then people respond. I think to some extent that's true. I think there's also the extent that you get legal scar tissue, like something goes wrong, and then you get a regulation as a scar over the wound, so to speak, and then that stays forever, even once the risk doesn't even exist anymore. For me, it's less about like we gotta get rid of this, but more about people needs incentives to do stuff. There is no economic incentive to make these vaccines. You can't patent them. They're too simple. All of the companies that made vaccines made something really novel, because then you can patent this stuff, and then only you can produce it. Like, if you spend millions of dollars or euros on testing, obviously you want to be the only one who can actually sell it. Because like, if you spend all of the money on testing, and then I can make the same substance once the tests are done, I'm getting all of the profit, and you're stuck with all of the costs. That doesn't really make sense. So I would just call for more public funding of non-patentable medical substances, on medicines, on vaccines.